Vanakkam friends, this is AR Arun. I am the President of the Southern India Chamber of Commerce and Industry, SICCI. On behalf of SICCI, I take great pleasure in welcoming Dr. V. Shanta, Chairman of the Adyar Cancer Institute, as well as each one of you to today's important program. I would like to wish each of you a very good evening. Today's program is important from two perspectives. The first, cancer, as we all know, has been a prevailing disease for a good period of time globally, and it's always good to understand the causes of the disease and the implications of it so that we can better handle it. Secondly, which I consider more importantly, as each one of us get to know the purpose of life and want to know what our contributions have to be during each of our lifetimes, we come to realize that we are gaining a lot of satisfaction in terms of assisting people around us. I'm sure that we can learn a lot from Dr. Shanta during the course of this conversation, as well as about her career so far. Before I continue, I would also like to share with you that we were scheduled to have session 3 of the SICCI-360 series the end of last month, but had to postpone it because of the cyclone Nivar that was happening and the aftermath of it. This program is now scheduled for the early part of January, which I'll be sharing with you towards the end of today's conversation. The Southern India Chamber of Commerce and Industry, SICCI, as most of you would be aware, we would like to say is 110 years young today. During the course of this eventful journey, we have been contributing significantly to industry, society, and government. In the course of these years, we have conducted several programs for the benefit of our stakeholders. And each one of these programs we've invited eminent speakers from across various walks of life who have visited us and shared about their expertise. Invariably, these addresses have been for about 20-25 minutes and oriented towards the guest speaker's area of expertise. We, however, felt that there is a lot more that each of our guests have to offer in terms of getting to know about their career, getting to know about their value addition, the reasons why they've reached that situation of eminence, as well as their inputs for the next generation, as well as society. It is with that in mind that we decided to come up with the concept of SICCI-360. Can we have the slide, please? Next slide, please. Before I continue on this slide, I'd like to draw your attention to the bottom of the slide where we have the names and numbers of two of our executives listed here. If any of you have any problems reconnecting back into today's program, please feel free to give our two executives a call, and they will be glad to assist. So as I was saying, SICCI-360 is a new foray for SICCI, and it is building on the concept of our seminars. The name SICCI-360, we wanted it to depict a multidimensional perspective that each of our programs aim to be. It is a lively discussion with eminent guests who are experts in their fields and who can share with us their all-round paths to excellence. Importantly, we also look forward to the guests' inputs for the next generations. The format of the SICCI-360 series, for those of you who are not aware, is we talk about 5 different sections within our program. We start off with our guest speakers' expertise, their organization and their role within the organization. Thirdly, their career path. Fourthly, their inputs for the next generation. And finally, their inputs for society. We certainly encourage our audience to participate. The 2 guidelines that we follow within this program is, number 1, we would like our guest speaker to be at comfort at all points of time. And number 2, we would certainly like our audience to gain by Nobel laureates, Sir C.V. Raman, who was her maternal granduncle, and Mr. S. Chandrasekhar, who is a maternal uncle. Dr. Shanta completed her MBBS from the Madras Medical College in 1949. She completed her DGO in 1952 and her MD in obstetrics and gynecology in 1955. After the Public Services Commission examination, Dr. Shanta was posted to the Women and Child Hospital. In the 1940s to 50s, when we had Indian women entering the medical profession, most of them generally preferred to take up obstetrics and gynecology. But however, Dr. Shanta wanted to be different. Dr. Shanta wanted to pursue the path of cancer, assisting people in need. She's been with the Cancer Institute, called the Adyar Cancer Institute, ever since its foundation. She took an honorary role with the foundation during the first 3 years. After that, the institute offered her a salary of rupees 200 a month and also residence in the campus. She then moved into the campus in 1955 and has been there since. But the part that I personally like the best is Dr. Shanta is a person of compassion and wisdom that has been mustered over 9 decades. Her passion for care is evident not only in her words, but importantly in her actions. Dr. Shanta is a phenomenon that has happened to India when cancer care seemed to be a distant dream. Dr. Shanta has steered the Adyar Cancer Institute to top ranks and has been instrumental in providing state-of-the-art cancer treatment, making it accessible as well as affordable to the society at large. Dr. Shanta was elected Fellow of the National Academy of Medical Sciences and is also a member of the Tamil Nadu State Planning Commission for Health. Dr. Shanta received the Ramon Magsaysay Award in 2005, and this award, in turn, Dr. Shanta dedicated it to her institute. With those few words, I would now like to again welcome Dr. Shanta to today's program. Dr. Shanta, thank you very much for joining us. It's a great pleasure to have you with us. A very good evening to you.
Thank you very much for the honor and opportunity to talk about Cancer Institute, which I think is a unique institution, and about cancer, which is a global health problem today. It is not only a global health problem, it is increasing in size year by year. As a matter of fact, when we started having the first statistics in 1984, before that there were no statistics on cancer. I think the burden of cancer was about 4.9 lakhs. Today it is 13.9. There is an actual increase of over 1% annually. The problem with India, the problem of cancer in India is the increase in rise increases the burden. When we say burden, because of the demographic effect, the population, wherever, in spite of the fact that our incidence is much lower, smaller, the burden is much higher between, if you see the affluent countries here. Anyway, I do not want to go too much on the statistics. The common cancers in our area are the accessible cancers. It is very fortunate that we have the accessible cancers. There is oral cancers, there is a head and neck, then we have cervical cancer, and we have breast cancer. Having said that, I would like to say my experiences with cancer goes back to 1954. 1954 was the founding of the Cancer Institute. At that time, there was no facility for cancer in India as such, and of course in Chennai, and people had very little knowledge. There's awe about the cancer. Everybody felt cancer means death, cancer means pain. I think there's a terrible misinformation and misunderstanding, including at the highest level. It was at that point of time in 1949, when I was a medical student, I happened to hear about cancer. Dr. Krishnamurthy had talked to us. I mean, he's a visionary and idealist. And I also heard Dr. Muthulakshmi Reddy, his mother, who's been a women's pioneer and wanted to do a great deal for cancer. She lost her young sister of a cancer way back in 1923-21 when and there was nothing at all. It was a misdiagnosis and she died of a cancer. So from then on, she had made up her mind. It was the dream that was born at that point of time, which fructified ultimately in 1954, I think. So having said it, I'll have to go back to, I can talk about the Cancer Institute origin and growth for months together. I think it is not possible. Suffice to say, we have the problem at that point because nobody knew about it and there were no facilities for treatment. Any patient with cancer only died, including the minister said, why do you want, when Dr. Muthulakshmi Reddy wanted to start a cancer hospital, he said, why do you want a cancer hospital? Cancer people only die, old people only get cancer, and we don't have sufficient money to do that. So it went on. But she was adamant, she was passionate. She said she will do it, and that is the dream that has come. We started life at the time with 12 beds. Today, we are a comprehensive cancer center with about 650 beds and completely devoted to the underprivileged. The ethos right from the beginning is that we have to treat the underprivileged because they don't have the facility for cancer treatment. Unfortunately, in this country, in that area in 1950 and 70, whenever people got cancer, the high-level people, the next day they were at the airport going off. They just did not bother what happened to the others here. They said, people die, what do you want to do? Why is it that they are going abroad and not permitting them? That was the reason Dr. Reddy had wanted us to start. Well, we have between 1954 and today, there has been a phenomenal improvement in every aspect of cancer, in awareness about cancer, scientific knowledge, and technology. It has given us a transformation in the management of cancer, in the outlook for cancer. Again, unfortunately, it is the lack of information to the public that they still continue to think of cancer as a deadly disease. It is a lack of awareness, and I think I should tell them more about it. I think I should stop now and wait for some questions.
Thank you, Dr. Shanta, for that introduction. Before I go into the points, is the audio clear? So if you want to adjust the mic, you can please do so.
Arun, we are able to hear, but we are not able to see President.
Can we go ahead? Dr. Shanta, while we understand what you have spoken, we'd like to know, how does a person contract cancer and how can they avoid it? When we also look at children, what is the reason for the rise in pediatric cancer in particular?
No, the lack of information and misinformation. Cancer is not a single disease. It's a multiple diseases. It is a heterogeneous condition consisting of hundreds of cancers. Cancer can occur from top to bottom of a man and a woman. Start from the scalp right up to the foot. Every organ in the body. No organ can escape cancer. And this is the reason why the causation of cancer becomes a little difficult, because each cancer is different. No two cancers are alike. Each cancer is different and the causation is different. And certain cancers have limited information on the causation, and there are many cancers about which we have well-known causes. And it is this that makes the treatment possible and curable. The accessible, we have to be, India is fortunate because we have the more curable cancers. That is, I'm talking of, we started before, like oral cancer, which is caused by tobacco. We can prevent oral cancer by stopping tobacco. We need only a kind of a political will for it, which we don't have. Then cervical cancer, most easily diagnosed. And then breast cancer, these are the common cancers. Now, we are going on to an era now with a changing trend. Other cancers which are less curable are coming up for various reasons. Because of the lack of information, people come for treatment in a very advanced stage, not only advanced stage, at that time with limited facilities.
Our next point today is from a student. He's a third-year student at Kilpauk Medical College, and his name is S. Akash. He says, quote, "How do some cancers regress spontaneously?"
I think he has to give examples. Very rarely you see, these are only, we'll have to make sure, I'm not quite sure that they regress automatically at all. I think.
You've also stressed, Dr. Shanta, on the importance of statistics in epidemiology. How does this help medical practitioners battle cancer?
It is the only thing that can give you the causation and the type of treatment that you need to take. If you go back, how we found out tobacco and what are the various positive factors, you will find way back in 17th century, Sir Percival Pott diagnosed the chimney sweep cancer as a scrotal cancer because these boys were climbing up and then cleaning, and then there was a charcoal, and then cancer. And Abraham Phelps in 1905 in, I think it was not Navy, one of the, he found out the association of tobacco and cheek cancer. These are called observations. And in epidemiology, you study a particular cancer in a particular area, in a particular population. And you find that you're able to have certain cancers more in some areas and certain cancers not in that area. And not only that, you see the trend. When you see in India, now if there is time, I can tell you how cervical cancer, the commonest cancer in women, was the top cancer. Today has taken the second place. How has it happened? We have to find out. That is where the data is important. And there is a difference between urban and rural areas. Again, this has got to be validated. This validation comes from statistics and data.
When we look at cancer research, what would you say are the constraints facing researchers today? And what about vaccines putting an end to cancer?
I think to answer that question takes, without being trying to be short, the most important thing is attitude and aptitude has not been created for a long time. And now when all this is starting, people are important, technology is improved, everybody is willing to do. There's a lot of lack of interaction between the medical professional and the scientists. That is a great drawback. We need it. The medical professionals are not willing to go into research. It doesn't give them as much money as laboratory work. Laboratory work is strenuous. It takes time. You don't get an answer today, in 1 year. Answers take years to come. And it needs high-level funding. This lack of funding was definitely there for many years. More recently, only the governments have realized and tried to make it. So, lack of funding, lack of appreciation of the need for research, many of these factors have been a block for improved research, but I think we are doing fairly well at the present moment.
These were the questions that we had for you under the first section, which was about your expertise. We now move on to the second section, which is about your organization and role within your organization.
Exactly, would you want me to talk about my organization?
In 1954, in 1954, you had mentioned that during the year 1954 onwards, we did not have a single child alive after cancer treatment. Today, however, we've come a long way, and more than 65% of children who have cancer are getting cured. How do they be able to achieve such a good feat?
I think the world has achieved it and we are part of it. What we have achieved is much less than what I would want. The 65% pediatric cancers takes a lot of money, but that is important because everybody is not able to afford the treatment. But the 65 has to become 80%. In the affluent countries, the cure rate for this particular type of leukemia is 80%. We are now only at 65. We should not, we cannot say, I mean,
Can I be satisfied with 65%?
with the laurels. I think it is totally not a laurel. You're talking of so many awards and all. Awards have no meaning till you're able to cure every patient that you see.
The Cancer Institute has been a voluntary and charitable organization, and certainly there is a good requirement for funds in order to be able to ensure that necessary treatment is provided. It's a remarkable effort that's been done with the Cancer Institute, and you're also providing the best treatment to patients. What's been your challenges? And in the course of that, how do you also take care of of patient satisfaction in spite of the challenges that you face?
The challenges are innumerable, starting with advanced disease. The first challenge is advanced disease. When we want to tell the public that cancer is curable, we must be able to cure them. Then only they will be able to, accept it. If every patient that you treat that goes back without a cure, they cannot accept it. So advanced disease and early detection is the more important. We started the program years ago. Say the Cancer Institute is a unique institution for many reasons. We are unique in the sense we had a vision of what is needed for patient care decades ahead of the government, starting with the screening programs way back in 1968. I did a survey of Chengalpattu, the first survey like that. I personally did it, and we had a big story on that. I cannot go into that. We wanted to have the first cancer screening program in Kanchipuram in 1968 with the help of NORAD and WHO. We did all this paid work, all this cut work, and I was appointed the officer in charge. We had to sign a MOU or whatever you call it. The WHO at Delhi said they cannot sign a MOU with a non-government organization. That started our government, non-government divide. How do you think it fits in? It continues today. That challenge is there. Advanced disease, then the lack of appreciation of work. Of course, funding is there, a lack of understanding. Funding, I always say, funds we can always get. There are enough people, enough money, enough good people who want to share money. But you have to get people with commitment, because there is a failure. There are a lot of failures. Many a time in the earlier days, doctors did not want to work in cancer hospitals anywhere because you all saw a lot of people dying. It is a little hard to say that every patient, so they say we don't want it, we want to go. So we will have to see that we are able to cure, and the object will be that. So these are all the areas, and I can't say by providing something to the patient, I think you can always get that return I felt action is their duty, fruit is not their concern. If you follow the tenet, I think we can get it. Money comes, men don't come.
Make sure that our efforts are always on the line and not worry about the results. The next point is you've been in service for 6 decades, Dr. Shanta, but you still attend to patients, you perform surgery, you're on call 24 hours a day. What gives you the strength? How do you perceive this journey of yours?
Well, I want to correct it. I'm not on call 24 hours. It's almost now, from March, I don't see patients. And I don't do surgery for the last 10 years after I had a stroke. The Magsaysay Award people wrote that I think it is coming. So I have been there more than 60 years I have been doing, it is right. The strength comes from work satisfaction. Whatever work you do, you're happy with the work and you feel that you have done the best, that you have not failed. You keep thinking, have you failed and have you tried to correct yourself? I think if work is a prayer, I think there is always strength. There's no need for it. Today, with the pandemic coming, everybody says, I'm not feeling it has only created a lot of indiscipline and a lot of people not wanting to work. I think work satisfaction is important.
Excellently said. We now get into the third section, which is about your career. What inspired you to MBBS after PUC from Presidency College? What made you want to be a doctor?
That's a long story, which I have answered any number of times. Just as a doctor, I made up my mind I have to be a doctor. I think I was probably in the 10th, those days, 10th, 11th, 12th was the same like the present. So I wanted to be independent. I had seen a lot of people. We have a large family and people were all, my grandfather was very interested, very he appreciated the need for education of women. So everybody was educated. All of us were educated, graduates, otherwise or anything. Of course, the educated people, they all got married and went off. I mean, I saw all of that happening. And I said, that's not a very nice way. I wanted to be something very different from not one of a crowd, as you call it. So that was what made me wanting to be a doctor. Then my parents were very supportive. My mother is is an incarnation of patience. Of course, my father was a disciplinarian. And they were very supportive when I said that I wanted to be a doctor. And so there was no problem. And mind you, at the time, I didn't have to pay a fee. Women doctors were very few. And I did not have to pay a fee, and we were able to do that. So went on. And then I came to cancer. I always said, why did you pick up on cancer? That is again a story. I think I've said it again and again. And I think it is a destiny, I should say, a conjunction of stars. I should say at that point of time, we had just had our independence. We were hearing Prime Minister Nehru talking of a glorious India, what the younger generation can do. I said, yes, we'll also be part.
If I might stay on the light-hearted side, perhaps you have a good scientific gene pool within you from where you come from. But you've also spoken about Dr. Krishnamurti and the inspiration that he's provided you, especially during your final year of MBBS and going into your first year of residency. Certainly, such motivators, such mentors are very important for anybody to not want to stand in a crowd and to be aside. Would you say that such motivators or mentors should be sought after by the next generation as they go about building their careers? Or should the next generation wait to come across such motivators or mentors? What is your advice?
Advice for motivation is practice of what you teach. Practice of what you tell them. Values and principles are there. You have to follow it. If you don't follow it and say, yes, lecture them. It's not going to be. You must be able to do it on your own and show your students, everybody working with you. That is very important. And as a visionary and idealist, Dr. Krishnamurti practiced every word of what he said. And I think that has been a great influence.
What about from the student point of view, Dr. Shanta? From a student point of view, a student who seeks out a mentor or a motivator, should they seek out such people or should they wait to come across such people?
This is automatic. If you tell me in school, I had motivators. In college, I had motivators. It depends upon the school environment. You start with a family environment, school environment, college environment. This is where you pick them up. Today, education, we do not, I can't say anything more, but everywhere I had excellent people and motivation. Everywhere I had.
We'll now come to the second student question. This is from a person who is also organizing committee, Ms. Vilasni Arun, and she says, quote, as a woman who became a doctor during times when India placed men at a supremely higher pedestal, and often women couldn't go even to school, let alone pursue an MBBS degree. I first want to commend your strength and perseverance. Could you share with us your experience as a female doctor while you were studying and obtaining your degree, and what advice would you give other women who want to achieve their dreams of being a doctor or any profession, regardless of her background in terms of wealth, caste, child marriage, etc., unquote?
Well, I don't have much to say on that. In earlier years, many women doctors, sort of stopped halfway, and even after they qualified, did not continue. And I always used to feel it was a waste of energy. That is earlier. But today, all of them are doing very well. And I think they have a problem, no doubt, because they have to have the family and the medical profession. It is a great thing to do both, justice to both of them. There's no doubt at all about it. It very much depends upon how well they are able to get on with their partner. I think I don't have to say anything to the women because they know it. But suffice to say, whenever you take a job, you take a career, you have to do justice to the career, irrespective of what problem you have. You have tried to get over the problem. I think that is a major problem even today, even at the highest level. When women are working, they continue to have the problem. It is a pity, but I think today people do understand that women can play a better role than what they are today. I think the number of high-level women is not adequate enough to change the country's face. I think many things like corruption, I believe, can be controlled by women better than men.
The last question in this section is, when you started practicing, oncology was not even a word that was known within India and came much later. You said that it's progressed very well since that time. Has this been based on what you perceived it when you first started off? Are you satisfied with the level of development that has taken place?
No, I don't understand your question. All that I can say is, initially it was called cancer. Subsequently, it went on to oncology. Cancer is a name of a disease. Oncology is a discourse on the science of cancer. So there is a lot of difference, and academically, this came to our mind because the advances in technology that was happening between 65 to 70 was a dramatic period when all the molecular biology came in, and then technology increased, your imaging facilities increased, when all these things, and the dawn of chemotherapy, as we call it, the drug treatment of cancer came in around 65, 70. When all these things came together, it was very important that we integrate everything together. And therefore, you had specialties. That specialties came in because of all the advances. And I think it was very necessary to tell our people, even till 1970 in India, we did not have that bifurcation. All our surgeons and medical people thought cancer is only radiation therapy. Radiation therapy, they did, and surgery. I mean, the surgeon wanted to take whatever came, he wanted to cut. And then radiation therapy had a bad name because we did not have good enough equipments at that point. That is up to 1960s. After that, the transformation in radiotherapy came. So when all this came, nothing was happening. We started saying oncology and applied to the Medical Council of India that we must have a specialty areas in these for cancer. One, this surgical oncology, medical oncology, radiation oncology was always there, and therefore, but it again took us almost 10 years to get it done, get it approved by the Medical Council. We started our work in 1970-71. We got the approval in 1982. Till that time, there was nothing in India. It was 10 years later that the other centers in India came. Ours was the first on special oncologic specialty college. We wanted to name it after Dr. Muthulakshmi Reddy, but she would not agree, in the sense she believed that no names should be attributed. We are doing it, and the same way with Dr. Krishnamurthy. So it went on. So now today oncology has become a major specialty.
Friends, as we move on to the fourth section of today's program, which is our eminent speakers' inputs for the next generation, I would like to share with you that as I was discussing with Dr. Shanta about today's program, and I was inquiring with her about her motivators and her inspirators, if I might use that word, and so on, I was pleasantly glad to know that one of Dr. Shanta's main inspirations has been her younger sister, who is 10 years younger to her, Miss Sushila. And Miss Sushila is also joining us today. She's with us today. Very glad to have you, Miss Sushila. And that told me that inspiration, or motivation for that matter, doesn't necessarily have to come from people older to us. We can certainly gain inspiration also from a 360-degree point of view. We can look for inspiration anywhere. And I'm sure that that's a very important attribute that we should all be able to take from Dr. Shanta as well. It is said, Dr. Shanta, that certain exposures and habits of today's youth, the chances of getting cancer can perhaps be reduced in the future. What do you think about this? If they are able to change some of their attributes, if they are able to change their lifestyles, their chances of getting cancer in the future?
Yes, much can be done. What we call the lifestyle diseases. Today, cancer is one of the lifestyle diseases. It's a non-communicable diseases. These things have come up. It was always there, but it is increasing. Now we can prevent them, so we can reduce. There are certain cancers that can be prevented. There are certain cancers about which we have very little knowledge. So let us control the preventable cancers. We would have done a great deal. I think we are able to do it. Whoever does it can get 3 Nobel Prizes. I think it is a cancers like brain tumors and many other areas is difficult. What we have achieved in the 60 years for these accessible cancers, another 60 years, we are definitely going to do something for them. So it is a possibility. But as of now, we can reduce cancer. Prevention is the thrust today. And as I said, prevention, how? I think the environment we live in, the food we eat, the hygiene we practice, the abuses we indulge in, I think these are the areas. I think one of the worst things is the food habit and the tobacco is the worst. Next, I would say, is alcohol, not to the extent of tobacco. Eradicating through oral cancer, lung cancer, you can eradicate. I cannot say we'll eradicate 100%. Nearly 80% can be eradicated. 20% will still continue. That, I think there's a big why I don't want to take up the time, is possible. So it is possible to reduce it. Tobacco can be completely eliminated. You can reduce your oral cancers. Lung cancers can go down significantly. And then food habits and the high cholesterol diet, one of the major causation for increase in breast cancer, and the high cholesterol, high meat, high non-vegetarian food, which is giving rise to rise in colorectal cancers. So everything is possible, but I don't say you have to give it up completely. Like tobacco, we have to give it up. But in all these diet habits, moderation. In anything, moderation is important.
We'd be glad to know, Dr. Shanta, as well as for the benefit of our friends. Within SICCI, we have started what is called a Food and Nutrition Committee. Earlier, it was part of our agriculture efforts, but we decided to separate it out this year and concentrate on food and nutrition. This committee is working very closely with the FSSAI, the Food Safety and Standards Authority of India, and also with the government of Tamil Nadu's Food Safety Department. And the idea here is to promote Eat Right. There's a campaign that FSSAI is coming about, primarily to be able to address this. So if you are able to address the nutritional aspect of food, the cleanliness habits of food, the right kind of food to be eaten, I think that can go a long way in terms of reducing the instances.
I think you will have to get a better person. I've not concentrated on that. We know by statistics all these are there, but it should be possible. There are many people who are doing the studies and data is available.
You've talking about the next generation again, you've said any technology should be beneficial to individuals and community. What does not benefit the community, you've also said that increased use of mobiles and gadgets in today's children is definitely increasing the EMFs, or electromagnetic fields. What association do you think EMFs have with cancer, and is there a way out of this?
As of now, there is no data to say that it is increasing cancer, but for you to get this information, you will take years. It will not come in 5 or 10 years. It will take about 40, 50 years. At the end of the day, when we may not be here, we may have the answer. So what I normally advise, moderation. See, these technologies are wonderful. They've created such convenience and comfort and data collection, so many things. But everything should be in moderation. Today, if you see many of these children, they keep on talking hours together. I think that may not be wise. That's all we can say. Moderation. If in food habits, moderation. In any other habit, moderation. I think that will be the most important thing. And they have to understand all new technology is not wonderful. Technology is wonderful only when it is not years ago.
Talking about your school days, you've said that you really enjoyed your school days, that you did not look forward to weekends, to go to school and spend as much time there. And the reason for that is because of the kind of parenting that you received. It was really supportive, and your parents played a very good role in encouraging you. Do you feel that this has now changed from what it was several decades ago?
Well, I don't know what is happening in the schools, but whether they get the same thing that we had, I don't know. I can't say anything on the subject. But I do believe the children have to be molded at that point of time. The best molding comes from home. The second molding comes in the school and then the college. How much of it comes, I can't say. We hear a lot of things. I don't want to talk about things that I don't have direct information.
We now move on to the fifth section of our program, which is on society. We have a student, R. Pramod. He's a third-year student at Madurai Medical College. And he says, quote, "Doctor, you are a great inspiration to us. In one of the interviews, you observed that 76% of movies show tobacco in some form, and 50% of the time the hero is shown smoking," unquote. How do we change this malady? Actually, he also says that. When we look at government advertising today, they also say that tobacco is bad and it should not be done. When it is a known fact that it's cancer, it should not even be done in moderation. What is the logic to the ban not happening on such cancer causes?
Because the tobacco lobby is too strong. Political is needed. Support. Tobacco growing is given a, whatever you call it. I think if you ask the tobacco people, they will tell you. We have a program where you prevent tobacco sale at schools. They doesn't do anything about it. We have been keeping on writing that because there is probably some influence at a higher level on tobacco. This is what happened everywhere, including US. There are a lot of problems, but it improved because of education, not because tobacco went down, but because people were able to understand and gave up smoking. So the same thing should happen here. But I think in India we don't have adequate support for influencing tobacco control.
You've also mentioned about bringing together medical services, art of giving within humanities and social sciences. Humanities and social sciences is a very important aspect. In fact, one of our committee members, Professor Murugavel, is head of the Department of Humanities and Social Sciences. And you've spoken about within this curriculum to be able to encourage the thought processes towards providing medical services and as well as the art of giving. What are your comments, Doctor?
It's a long story because compassion and the way you communicate is very important for patient satisfaction. When a patient comes to see you, you have to respect. You have to respect your patient. That's vital. How many patients, if you go to the outpatient in a big hospital, how many people standing, nobody to tell them, please sit down. They don't even say, please. They don't even say, sit down. So this kind of a communication, the way you have to treat a patient, I always say, treat a patient. If the patient is your brother, your child, your father, your mother, how will you treat? Same way you treat the patient. Then that is humanity. Because you will never be, rude to your parents. You cannot be to your children. So think of them when you're seeing a patient. He can be your brother, he can be your father. So that kind of an attitude has to come from the teaching of humanity and social sciences in the medical curriculum. How many medical people seek medicine because they want to help? Yeah, we don't know. I think they have all this kind of counseling and other things. I do not know. So I think that is important. Compassion is necessary. We have times when people have advanced disease where we are not able to do much, but we have to bear with them. We have to tell them that this is like this, how you have to, when you treat them well, I think the satisfaction goes. So this compassion, doctor-patient relationship around areas which are not part of the subject need not have been, because when we take the oath of Hippocrates, we know that we have to do. But our people, somehow it has not happened. So let us introduce this and see that the medical profession, more and more of them, I don't say none, but majority.
As a chamber, we'll certainly follow through on this point as well, because I think it's an extremely valid point to be able to build this art of giving as well as understanding about compassion and so on. There is a book that has been compiled by you. It's called My Journey Memories, and it has a collection of memories from patients who are willing to share their experiences. What was the purpose of this book, and did it achieve it?
Well, it is given to every patient who comes and says what they have to go through, and it gives an idea that there is nothing to say that they are going to die, they can be treated. But there and everywhere you would find there is a small note written by me as to what happened. A patient that did not do well, I'll say why this patient did not do well. It would have been late disease, or patient did not come, or patient came early. So the object is educating the patient.
Certainly a lot of fright and depression about cancer. What efforts do you think the authorities, the administrators, the government as well should take to instill confidence that cancer is curable?
Oh, government cannot do anything. It is us, the medical profession, that has to do it, cure more people. So there is no, they can do more by making cancer treatment available, but getting them early and all, again, they have to support preventive oncology, as we call it. Preventive oncology, prevention must be the thrust, not high-level treatments that can wait. That is there, but we have to do early disease. Prevention is cure, because we do know what we call health screening. The concept of annual health checkup comes because of that. And I think it is possible to do it and try to get early disease, but it should not be taken as a kind of unethical practices.
Thank you, Dr. Shanta. Has there been any questions? Are there any other points that you would like to share with us, Dr. Shanta, today that we've not covered?
Haven't covered anything on the why cancer, what the trend of cancer, why this happened. I think we have to have a separate one only on cancer.
Would you like to share a few brief comments about it?
Now, let me say oral cancer, lung cancer, breast and cervix. Cervical cancer was the top cancer to start with, and now it is the second. How has it happened? Breast cancer was the second, now it has gone to the top. Why is it happening? What can be done? Colorectal cancer is going up, again, food habits. So these are here, and the cervical cancer essentially has come down because of education. Both cervical cancer and breast cancer, if you see their incidence pattern, is directly related to education. You take the illiterate, middle school, higher school, college, it is the reverse. In cervix, it goes down, and in breast, it goes up. The breast cancer is much lower in the poorer area and much higher in the educated. Why is happening in the more educated? Lifestyle, socio-economic. Everything is related. That you can get from the data that you collect from people. So everything is possible. So we have to continue our mission of cancer care and cancer cure. Every cancer professional should take it as a mission. The cancer patient, they come to them, is their responsibility, whether they are going to be all right or not all right. You fail many times, you don't succeed every time. Even if you take it as 50-50, 50 times when you fail, you cannot ignore and put them away saying nothing can be done and show them somewhere. This is what is happening. You have very good palliation. Palliative care is one of the most humane areas that can be done.
Friends, I'd also like to share with you another point that I was taken back when I was talking to Dr. Shanta. And she said that, as she's alluded to today, earlier in the conversation, her grandfather had a huge
Yes, library.
library. And he certainly encouraged women in his family to be educated and move on even to higher education degrees. So Dr. Shanta perhaps inherited this library collection, and she's been distributing it among her known schools and society. And she says that the reason that she was doing it is to be able to plan her exit. And I was taken back when I heard that, but that is the level of thinking to which and planning as well that Dr. Shanta is engaging in, that we should all be able to appreciate as well. Dr. Shanta, this brings us to the end of today's program. Certainly appreciate your very valuable inputs into us. As a chamber, we would be very glad to do whatever we can in order to be able to raise awareness and take things forward. In this context, friends, Dr. Shanta was also mentioning to us that whatever contributions that can be given to the Institute in order to be able to fight this disease and assist people recover, they would most gladly accept it. So whoever is able to do that, please keep the Cancer Institute in mind and support them to the extent possible. Dr. Shanta, as appreciation of your presence with us today, we would like to also make a contribution on behalf of SICCI to you. And to that extent, we'd like to give you this, please sit down, this certificate.
Thank you. Thank you very, very much.
This is a small contribution from our side, but whatever it might be worth for. Friends, to share with you that Dr. Shanta has given us this booklet about the Cancer Institute, and she's also mentioned that whoever would like to receive this from us, a copy of it, please let us know and we'll be glad to get it from the Cancer Institute and give it to you. In continuation, Dr. Shanta, we now have a new tradition within SICCI-360 where we would like you to autograph your photograph and also if you can date it for us.
Here?
Just below the
Here.
black line. No.
This?
Yes, correct.
Today is the 10th.
December 10th. Thank you very much. This is a tradition that we've since started so that we'll be able to have this for the memory of our chamber as we have guests who have joined us. Thank you. For today's program, friends, we would like to thank a few individuals who have assisted us. First of all, Dr. A.C. Muthaya, our past president, and secondly, Mr. Vijay Shankar, Deputy Chairman of the Sanma Group, as well as our Executive Committee member. Friends, I would also like to appreciate the work done by the SICCI-360 committee in putting this program together. As you would know, this is the third program that we are conducting in this monthly series. This committee is headed by Mrs. Valli Arun, President of the Veningro Group and Trustee of the Tamil Isai Sangam, Professor T. Murugavel, who is the head of the Department of Humanities and Social Sciences at SPCE. Professor Murugavel is responsible for putting together the discussion points concerning any of our speakers, and he's done a magnificent job in doing the required research work and background work to put together an exciting list of points that we can hence put forth. Thirdly, Mr. Vinod Solomon and his very effective team at the SICCI Secretariat. Fourth, Mr. Gokul Santanam, who's Senior Vice President at Emphasis, and he's responsible for our marketing collateral and marketing initiatives to get our program out. Mr. Amalan Alavandar, who's an environment consultant at Asian Development Bank. And finally, Ms. Vilasini M. Arun, who's a student of clinical psychology and represents the student community. Friends, we would like to share with you that the next SICCI-360 session, session 4, is scheduled with Grandmaster Mr. Vishwanathan Anand, who is a 5-time world chess champion. This event is scheduled for Friday, the 8th of January, and it's going to be held online as well as over WebEx. Please mark your calendars, and we look forward to you joining us for this. This brings us to the end of. Thank you very much. We certainly look forward to your ongoing participation with us. And I would also like to take this opportunity to, on behalf of SICCI, to wish each of you and your family a Merry Christmas and a very Happy New Year. Thank you. Vanakkam.